Hi everyone, welcome to Veru. So today we're looking at Veru and we're looking at the upcoming FDA meeting. Kind of exciting in a way, but also nerve-wracking because we don't know what the decision's going to be, and it could just literally change that share price overnight, basically. So the meeting is going to be on November the 9th. We've known that for a while now, and any submissions that people were going to put in, see the public participation information. The deadline for making formal oral presentation requests was basically October the 26th. And then basically the contact person will notify interested persons regarding their request to speak on October the 27th. So anyone that was interested in speaking should have already put in their application, and it would have already gone through by now. And basically there's no changes to the November the 9th date, so I assume there's no more delays. Meeting time, so it's originally scheduled for October the 6th, and now it's at November the 9th, and it will happen from 9 a.m. to 5 p.m. Eastern Time. The meeting was rescheduled to allow time for the FDA to review new information submitted to the application, which makes sense. You know, there's a lot of information, so they're going to take their time. And that kind of just sums up the gist of the meeting. There's not a lot that they're really giving away. So in terms of the people that could be the ones deciding this, so we've got the Pulmonary Allergy Drugs Advisory Committee roster. And if you look at here, the meeting of the Pulmonary Allergy Drug Advisory Committee. So I assume it's these people. And if they kind of have this here for anyone that's looking to be part of the FDA in terms of the kind of an advisory committee. So applying for membership of the FDA Advisory Committee, what does it take? So as part of the FDA ongoing efforts to recruit qualified experts with minimal conflict of interest who are interested in serving as FDA advisory committees, FDA is requesting nominations for members to serve on its advisory committee. So there you go. So they're basically people with minimal conflict of interest. So potentially these people could have conflict of interest, and that can kind of affect the decision for Veru as well. Current number of vacancies, there is 0, so it sounds like they've got enough people. So in terms of the people involved, we've got the chairperson, which is David H., and he is an expert in pulmonary and critical care medicine. And then we've got the designated federal officer. Yeah, so the name, I think it's Takiya, if that's how you pronounce it, or and they are basically the division of advisory committee and consultant management. And also, if it's not clear as well, it also shows the profession. So the chairperson is a professor of medicine at the University of Washington. And then yeah, so we've got our pediatric allergy and immunology. So this is also a professor of pediatrics. And then we've got another pulmonary medicine drug development, and this is a vice president of clinical pharmacology pharmacentrics, and they're part of AbbVie. So I assume, given they're part of an organization, but this is so if we look at the two stars by the name, we'll actually see that they're an industry representative, but they're actually non-voting. So that's, in a way, it's good because they're part of a company, so that conflict of interest is probably too high. If AbbVie was kind of focused on developing a COVID-19 treatment, then potentially there would be a conflict of interest. So if we look at here, so we've got a consumer representative. So this person is going to be more, in a sense, looking out for how is approval of this product going to affect consumers. And then we've got this person that's an expert on pulmonary medicine. And then we've got pretty similar things like pulmonary and critical care medicine, pulmonary and critical care medicine, allergy and immunology, same thing here. So yeah, so in terms of your experts, these are your people that are going to be the experts. So a lot of people that are kind of from universities. So I've got associate clinical professor of pediatrics, University of Nebraska, and basically we've got professor of medicine. We've got a director of the University of Washington. So we've got an associate professor of pediatrics. So we've got a staff physician. Got professor of medicine. So you kind of get the idea. A lot of like academic type of minds that are part of this. So we've got associate professor of medicine and physiology, and then we've got a professor and chairman in terms of department of pulmonary medicine, and then we've got a consultant. Yeah, so more or less a lot of professors. Yeah, and so basically these are the people that are going to be deciding this, which is going to be an interesting one because we actually don't know how they're going to decide. We, as an investor, you probably, feel like, oh, the data is really, really compelling. But again, there's a reason why it's referred to a committee, because there's kind of some doubts on whether the sample size is big enough in terms of what they're looking for. So yeah, like, as much as it could be compelling, there potentially could be requests of more data to be done or something like that. But hopefully not. Hopefully things go smoothly. And we'll basically find out in a week's time. We've been waiting for quite a while now, so I think to get a final conclusion for this will be kind of nice. Though, if they do not get this, it's not the end of the world. There are still a few medical agencies around the world that are still considering this as well. One of them being Canada, Europe, UK, Australia. So there's a few to really kind of hedge your bets in case this does not work out as planned. But I think the share price will not do well if things do not go well with this meeting, at least for the short term. Yeah, so that's what I really wanted to talk about in terms of this meeting. Yeah, I think until then, good luck with this thing.